Hi everyone, my name is Riley Cantrell and I decided to do my CRA on the cystic fibrosis community that focuses on patients and caretakers. So when I was in my undergrad, I was a junior at the time. One of my sorority sisters ended up passing away due to complications with cystic fibrosis. So that's one of the main reasons I decided to focus on this community. It's definitely something that's near and dear to my heart, and I just wanted to learn more about it and their information, needs, and behaviors, and ways that I can help. So before we get started, I just kind of wanted to point a few things out. So everything in this PowerPoint has something purple in it. Purple is the cystic fibrosis ribbon color, so I kind of wanted to honor it by having something purple. I will be referring to the disease as CF or cystic fibrosis. Just as a heads up, I'll be using them interchangeably. And finally, I discovered PowerPoint again and how awesome the slide transitions were. So pardon any funny transitions. I just thought they were awesome, so I wanted to throw them in there. All right, let's get started. Okay, so now I'm going to go over what cystic fibrosis is, some statistics, and the community description. So CF is a genetic disease that causes persistent lung infections and limits an individual's ability to breathe over time. According to the CF Foundation, there are more than 70,000 people living with CF, and over 30,000 of CF patients live in the United States. The life expectancy for patients with CF is a little over 40 years, which doesn't seem like a very long time, but it is a drastic improvement from the 1950s. Patients who were diagnosed in the 50s weren't even expected to live to see elementary school. Overall, the cystic fibrosis community is a very tight-knit community. They all interact with each other and they connect on a personal level, whether they have the disease or they know a family member with the disease. Also, in terms of age, gender, and race, there aren't a whole lot of differences. White individuals are more likely to be diagnosed, but it's not statistically significant. Also, in regards to socioeconomic status, those with a lower status are more likely to have a higher mortality rate, but similar to race, it's not statistically significant. Most individuals are also diagnosed by the age of 2. There are also cases where people are diagnosed in their later teens, early 30s, and even sometimes their later 60s. The disease may tend to present itself later on in life, but more than anything, children by the age of 2 are diagnosed. There are also 3 groups within the community. You have your patients, your caretakers, and your medical team. So the role of the patients are to communicate how they're feeling, if the treatments or medications are successful. They also work as a spokespeople for CF and play an active role in CF communities by raising funds and participating in local charities to help raise awareness. They will also communicate with caretakers about how they feel and what type of treatment they think they should pursue. The caretakers play a very similar role to the patients. They often range in age, gender, and race. They can be parents, siblings, grandparents, godparents, just someone who's in charge of the child. And they play a really important role for children under the age of 18, especially when they're diagnosed at a younger age. They serve as the communication between the medical team and the child. They'll inform the team what's working, what's not working, and they also play as spokespeople for CF and advocates for more research and treatments. The last community within the cystic fibrosis community is the medical team. So they obviously play a very important role. They are informing and communicating effectively with caretakers and patients. They have to stay up to date on current research and treatments. There are normally up to 10 people on a cystic fibrosis team. So you have a nurse, a physician, a dietitian, social worker, respiratory therapist, program coordinator, physical therapist, psychologist, research coordinator, and pharmacist. So one of the main things I found when going through my literature research was that caretakers and patients felt like the medical team wasn't communicating efficiently with them. So that's something I'm going to dive in a little bit further when we look in the information needs of the community. Okay, so for my literature review, I focused on 3 articles that looked at the information needs of cystic fibrosis patients. The titles of the articles and the authors are listed below. So what we found, especially with the first article, is that patients and family members wanted to know more psychosocial implications of the illness rather than the medical side of the illness. Another finding was that when people were given information, they liked it to be individualized rather than generalized. So they wanted information presented to them in a way that they would be able to understand and not what works for most people. The other study, and probably one of the most important ones, is the last one by Sawicki, Sellers, McGuffey, and Robinson. This looked at patients with CF over the age of 18. And what they found out here is that they wanted to know information on future and potential treatments, but they also wanted resources to learn about dealing with their condition. So they needed psychological resources to help with coping, depression, and anxiety. So these are some of the things that I looked for when I was developing my resource audit to make sure I had those in there. Okay, so for information behavior, the 3 articles that I focused on are listed below. And the main theme that I found after going through the literature is that caretakers and patients with CF wanted components that had to do with technology. So they found information through using technology. The first study that's listed focused on web-based portals that included ways to communicate with the medical team, how to track the patient's health, and also a social media aspect. The second article also looked at how to develop an app specifically for cystic fibrosis patients. They included the same types of things, tracking health, communication with teams, a social component, and also ways to access the latest research. The final one, finding motivation, online seeking following newborn screening for cystic fibrosis, focused on the online discussion forums that parents are known to use. So what these are that parents are getting on and discussing with other parents different topics like about disease development, diagnosis status, how severe the disease is, ways to effectively communicate with healthcare providers, and how the disease impacts the family in general. So, like I said, the most common theme is going to be how information plays a role, and social media. Social media was another huge aspect of information behavior. So I made sure to include these things when I was developing my resource guide. So for my resource guide, I looked into Google. I used databases from UK's medical library to find these resources. So the ones that I broke them down into are databases and virtual libraries, newsletters and magazines, foundations, and social media. So some of the databases and virtual libraries that included were PubMed, Medline Plus, UpToDate, Mayo Clinic's on there, the American Lung Association. So these all provide great resources for individuals to look at the medical terms, also to see some of the psychological side effects and how people are coping with those. The second part, newsletters and magazines. The Journal of Cystic Fibrosis is a great one. It also includes the Salty Life and the Cystic Fibrosis Trust, which are testimonials and research, and also topics about experimental treatments and medications. I also included the foundations, which we have the CF Foundation and then the Boomer Foundation. Both of these provide ways to connect with individuals with CF and family members who know patients with CF. They also provide resources on treatments and medication. The last one is social media. So I have the CF Community blog, Team Cystic Fibrosis, Cure Cystic Fibrosis, and CF News are all Twitter sites or Twitter handles, and I wanted to include this because social media played such a big role in information behavior. Okay, so for my needs assessment part of the project, I wanted to kind of duplicate past research to see if it lines up. So I decided to do a survey that looks at both information needs and behaviors. I think that by doing a survey, I can reach a broad range of patients and caretakers, and this kind of allows me to establish a great population. It would also allow me to generalize my results to the CF community. That was one of the downsides that I found in some of the research articles, that it was difficult to generalize to the whole community. But my overall plan would be to connect with the CF Foundation and the Boomer Foundation and local clinics to put out these surveys to patients and caretakers. And I think by doing that, I get a broad range of demographics, and that will allow me to generalize my population. The survey would be broken down into 3 sections. So you would have the demographics, the information needs, and the information behavior. So demographics, I would have gender, age, race, and then it would determine whether or not the person filling out the survey had cystic fibrosis or was a caretaker of someone who did. For part 2 of the information needs, I have a list of information needs that have been identified throughout past research. So causes of CF, treatments, future implications, psychological resources, social life, that kind of thing. And I made a Likert scale for individuals to identify how important that information was. The next part would discuss if the individual felt like they've been given enough information on the same topics that were addressed in the previous. And then I also marked or filled out a box where they would mark which topics they wanted to learn more information about. The information behavior would focus on how they found information, what sources do they prefer to use, and communication with their medical team. I also dove in to see if they would prefer an application or a web-based portal to have in order to track their health, communicate with the team, and as a social media aspect. So based off of that, I think some of the benefits are that you're identifying some of the unmet needs, and you're also identifying concepts that people can use to create these portals or applications. I think that by identifying these needs and behaviors, these can also be utilized by different foundations and groups that work to help communicate with cystic fibrosis patients and caretakers. The other benefit is that you're really viewing demographics between age, gender, and race, which I didn't find a whole lot of when I was doing my research, so I think that would be beneficial to have as well. So these are a list of my resources that I used. Any images I had in the slide were pulled from Google, just as a fun fact for you. Okay, so that is the end of my presentation. I really appreciate everyone listening and the feedback. So have a great break, and if you do have any questions, feel free to email me. My email's at the bottom of the page. Thanks!